patient meets criteria for generalized anxiety disorder if they have 3 or more symptoms for at least 6 months. The key symptom is excessive worry about various things, such as the future, finances, relationships, or work. Other symptoms include muscle tension, feeling on edge, fatigue, poor concentration, irritability, and sleep disturbance. The patient must find it difficult to control the worry, and it must impair functioning and be distressing. Symptoms cannot be due to another condition or substance. Racing thoughts can incorrectly be interpreted by patients with ADHD symptomatology as inattention or difficulty focusing. If this is a concern, patients will need proper diagnostic testing for ADHD when not anxious.
There are several other diagnoses you may want to consider when thinking about GAD. Unlike in OCD, obsessions or compulsions are not a criteria for GAD. However, a patient can have a comorbid diagnosis of OCD if they meet the DSM-5 criteria. In patients with agoraphobia, the causes of their anxiety are more specific, such as being alone outside, being in crowds or open spaces, or traveling with others. Again, a patient can have GAD and a comorbid diagnosis of agoraphobia if they meet the DSM-5 criteria for both conditions. Certain substances or medications may also cause anxiety. If a patient is currently intoxicated or under the influence of a substance, you should evaluate the patient at a later date. It's also important to note that the effects of a substance or medication can last many weeks after the cessation of the specific substance. Major depressive disorder with the anxious distress specifier was discussed in the depression diagnosis video. Essentially, in this case, the patient meets criteria for major depressive disorder and GAD without meeting the 6-month timeline for GAD. If a patient is experiencing sleep disturbances as their main concern and GAD does not adequately explain their insomnia, you may want to consider a diagnosis of insomnia disorder. Patients with GAD can also have a comorbid diagnosis of insomnia disorder if they meet the DSM-5 criteria for both conditions. Patients with a trauma history or diagnosis of PTSD can have similar symptoms as patients in GAD. The main difference in PTSD is that the triggers may be different and related to the past trauma. It's important to gather a clear history from the patient to differentiate GAD from PTSD. Patients with adjustment disorder with anxiety can present similarly to patients with GAD. Patients with GAD typically have multiple triggers for their anxiety, and if a patient meets criteria for both diagnoses, you should diagnose GAD. Patients with panic disorder experience panic attacks with no identifiable trigger. They go to extreme measures to try to prevent future panic attacks. In addition, these patients do not usually have other symptoms that may qualify them for a diagnosis of GAD, such as fatigue and muscle tension. There are also multiple medical reasons a patient may present with anxiety. These are not discussed in detail here, but it's important to keep this in your differential. Racing thoughts is a subjective experience, and it's important to know how to distinguish the racing thoughts in anxiety versus in mania. In a patient with anxiety, the thoughts are overwhelming and particularly distressing. The content of the thoughts is often related to specific fears or general worries. In addition, the constant influx of worries and thoughts may cause the patient to feel more anxious or stressed. In order to distinguish racing thoughts in anxiety from mania, it's important to obtain and document high-quality objective information by observing the patient's behaviors or even contacting family members for collateral information. Patients with mania may also present with decreased sleep, but compared to patients with anxiety disorders, oftentimes they feel well rested despite sleeping less than usual. Specific criteria for a manic episode are discussed in detail in the bipolar mood disorder video. You may be thinking to yourself now, how do I differentiate anxiety and mania when talking to the patient? Here are some examples of what you can ask the patient to help you differentiate anxiety and mania. Consider asking the patient what the thoughts consist of and how the thoughts make the patient feel.
The two types of anxiety we can identify are cognitive and somatic. Cognitive anxiety is caused by one's own thoughts. For example, thoughts that can trigger anxiety could be lack of control, feeling they are going crazy, angering thoughts, or fear of dying. Anxiety can also be triggered by fear of somatic anxiety, which would be fear of appearing anxious. Cognitive anxiety can lead to behavioral inhibition, in which patients feel distress toward unfamiliar sensations or uncertainty and can lead to avoidance. Somatic anxiety is the physical component of anxiety and includes many symptoms, including dizziness, headache, nausea, abdominal discomfort, muscle tightness, shortness of breath, and heart palpitations. In GAD, these are typically triggered by cognitive anxiety.